Good morning, everyone. I am Megan Rogers with Indiana SHIP, the State Health Insurance Program, and I am the Northwest Volunteer Supervisor. And I am joined this morning with my lovely co-host, Susan Spilly, who is the Special Populations Coordinator in Indianapolis. Well, she covers the whole state, but she is based in Indianapolis. And we have a wonderful presentation for you this morning. Susan is going to share the most popular 5 Medicare mistakes, and there might be a bonus mistake thrown in at the end if you stay tuned for that. So Susan, I am going to throw it over to you to get us started on these 5 popular mistakes to avoid.
Right. Thanks, Megan. Good morning, everyone. I also invite you to ask any questions you have about Medicare in the comment section, and Megan's going to be keeping her eyes peeled on that. So feel free to ask us anything, because we want you to all to avoid some common mistakes. But if you have other questions, just ask them. Okay. So just a quick review on the real basics of Medicare. So when we talk about original Medicare, we're talking about parts A and B. And A is the inpatient part or hospital part of Medicare, and part B is the outpatient part of Medicare, all that outpatient stuff. Now we also have Medigap, also called supplement plans, and those are insurance policies that you purchase from an insurance company, and they fill in the gaps to some extent or a great extent to what Medicare Parts A and B don't pay. There are also things called Advantage plans, and these are also offered by private insurance companies. And you take your Medicare Part A and B, and oftentimes D, the drug coverage, and it is a managed care way to get all of those parts of Medicare. Those can include some extra benefits, but there are some rules that you need to understand with Advantage plans as well. So here's our first common mistake that people make. If you have an Advantage plan, many of them have what's termed here on the slide as freebies. These are enhancements to those Advantage plans. Things like coverage for dental, hearing, optical. Sometimes some of those Advantage plans have, I call them gift cards, that you can use to purchase food and other over-the-counter stuff. Sometimes they may offer transportation, lots of other things that Advantage plans are allowed as enticements or additional benefits to Advantage plans. But you know what? You're needing to follow some managed care rules. And on the other hand, you get these other things. But if you don't use those other things, sometimes you're giving up some flexibility and you're not getting what you should be getting. So please remember to understand your Advantage plan and all of the benefits therein and take advantage of those benefits. Now, I think it was this year that, or maybe it's going to come about in 2026, Megan, help me remember, that the Advantage plan insurance companies have to inform you of benefits that you didn't take advantage of. That is a new rule, or it's a coming new rule. But you know what? Don't let the insurance company tell you. You just make sure you find out and take advantage of all of those.
I think that's this year, I believe.
Okay? What's our number 2? All right. Now this is something that could be for people who have Medicare with a supplement plan and a Part D plan. It can also
Susan, I made a boo-boo and I clicked and I accidentally muted. There you go.
Okay. All right. Did we get the first
We heard you say number two,
All right,
and
terrific.
saying that for people with a supplement and a Part D plan.
Great. Okay, so this is missing that annual enrollment period or open enrollment period that starts on October 15th and goes through December 7th. So what can we do during that time? Well, we can look at our prescription drug plans and make sure that the one that we are on is going to be good for us the coming year. Or maybe it's not good for us for various reasons, like your drugs have changed throughout the year and your current plan doesn't cover them as well, or maybe next year they're not going to be covered at all or very well. So that's why we encourage all Medicare beneficiaries to make sure you're looking at your prescription drug Part D plan during this open enrollment period and then make some changes if you want to, if you find something better. And of course, SHIP counselors are standing by, ready and very willing to help you look at all of your options. The other thing you can do during this open enrollment period or annual election period is to look at those Advantage plans and make sure the Advantage plan that you currently have this year is going to work well for you going into the next year. A lot of times providers can drop Advantage plans, and if you want to stick with your provider, then maybe you could change. No guarantee your provider will be in the network the whole year because they can leave at will, but that's something. Also, your drugs. Um, most Advantage plans include Part D drug coverage. And so just like if you're looking at a standalone Part D plan, you want to make sure that your current Advantage plan is going to cover your drugs as well or better as they do in your current year. So those are some things that you got to check out. People don't do it. And oh my, do we get phone calls at the beginning of the year with people that are very distressed because they can't get their prescription drugs or they're super costly. So mark your calendar as soon as we're done with this Facebook Live program, October 15th, or you know what? Mark it on October 1st to call a SHIP site and get in to see a counselor to make sure that you know what's going to be good for you coming up the following year. Number 3, losing your in-network access. Well, as I just referenced, the Advantage plans usually require that you stay in network to get maximum benefit, or in the case of HMOs, you have to stay in the network to get any benefit. And so sometimes providers of Medicare services could be a doctor, could be a lab, could be an X-ray facility, could be a hospital. They can choose whether to accept certain Advantage plans or not. And so that is something that you may want to check out going forward to the next year. HMOs, as a reminder, you got to stick to your network. PPOs, preferred provider organizations, there is some out-of-network benefit, but guess what? You'll just pay a little extra for that. So always check out who's in your network, where can you go for regular care and emergency services during the upcoming year. And of course, when can you do this? Well, one time is that open enrollment period from October 15th through December 7th. There is an additional time for Advantage Plan members. Next slide. That additional, I thought it might be on this slide, but that additional time for Advantage Plan members is the first 3 months of the calendar year. You can change from one Advantage Plan to another. Another thing to note on your calendar. Okay. The other common mistake is losing Medigap coverage. Now, here's one way you can lose Medigap coverage really quickly. You don't pay your premium. They will likely cancel you. And oops, I forgot is not sufficient reason for them to re-enroll you and allow you to have a new, the same Advantage or the same Medigap plan. So you might, if you lose your Medigap coverage, you may be in a special enrollment period for Advantage plan, but you may have lost that guaranteed issue to go back to a Medigap plan. There are two trial rights around Medigap policies. These get a little bit complicated, but basically, you have one trial right is if you purchase an Advantage plan right out of the gate, being eligible for Medicare at age 65, and you enroll yourself in an Advantage plan, you have up to 12 months to try out that Advantage plan. And if you don't like it within that 12-month period, you do have a guaranteed issue to purchase a Medigap plan with no medical underwriting. That's what guaranteed issue means. The other trial right is that if you, out of the gate, as soon as you're eligible for Medicare, you purchase a Medigap plan, and maybe a few years down the road, you say, I think I want to try out an Advantage plan. Well, you can do that. You can put your Medigap plan on hold, as I say, or put it up on the shelf. You're not paying those premiums for this trial right time, and you can try out an Advantage plan. And this also lasts for up to 12 months. And if you decide Advantage plans is not the life for me, if you make the change to go back to your Medigap plan within 12 months, you can do that. Now, one thing is, it doesn't mean you're going to have the same price as you did when you put it up on the shelf, because there could have been premium cost adjustment. Maybe you've turned another year old and realized a premium cost adjustment. So, but you would be able to go back to that exact same Medigap plan. Those are the two trial rights. Our fifth mistake to avoid is getting hit with the old tax penalty for a healthcare savings account. Now, when you are enrolled in any part of Medicare, you cannot contribute to a healthcare savings account and experience those wonderful tax credits that you do when you contribute. And something interesting is that Medicare Part A does retroact 6 months, but of course, not before you're age 65, because then you're not even eligible for Medicare. So if you are working and contributing to an HSA past age 65, when you decide on your big retirement, just make sure you've gone back and counted 6 months before and stopped that HSA contribution. It's important to remember that Medicare only starts on the first of the month, so you're going to want to count back 6 months, but not before your 65th birthday, and stop that HSA contribution. Now, I always point out that this is an IRS rule. It's not a Medicare rule, but of course it certainly impacts our Medicare beneficiaries. But remember, money in an HSA, a healthcare savings account, is always available to use. It does not disappear at the end of each year. That's a different kind of or a different kind of savings account. So make sure you don't get into the hot water and have to pay back your contributions or your employer's matching contributions, and make sure that you're stopping that HSA contribution. And now we have our bonus. Here's another big mistake. Thinking that you don't qualify for any help. All it takes is just a little bit of consideration, and feel free to always call us at SHIP. We can help you problem solve this one out, do some initial screening, and then if you think you might want to apply for these great programs, we can help you do the applications right there on the phone or in person if you see a counselor face-to-face. There are two primary programs that we help people apply for. One is the Medicare Savings Program. The income limit for one of these Medicare savings programs is is $2,433 a month. That's not chump change. These are not necessarily super low income programs, because as a single person, you can have a little over $2,400 a month. And your resources, which don't include your house or your vehicle or your personal possessions, has to be around $9,660. Some trusts are exempt from this rule as well, but it does count things like 401ks, money in the bank, certificates of deposit, money markets, things that you can easily convert to cash. It can help you pay for your Part B monthly premium. For most folks, that's $185. It can cover the deductibles of Part B and A, and it can help with those co-pays and co-insurances, that 20% of Part B covered services and the co-pays that you incur when you use your Part A services. The other program is one that helps you with your prescription drug costs. And that's a program called Extra Help. It's administered by Social Security, and it can pay your Part D monthly premium. It can pay your deductible. And where the rubber meets the road is that it can lower the cost of your prescription drugs to no more than $14 and some change per medicine. And that's even for those super duper expensive medicines that cost hundreds of dollars or sometimes thousands of dollars. You would never pay more than $14 and some change per prescription. And of course, many of your prescriptions would still be zero or lesser dollars than 14. There's another program that we help people with that's not on the slide, and that's called Hoosier RX. And Hoosier RX uses the same income guidelines as Extra Help, but it doesn't consider any of your assets. So perhaps you do have a 401k that you're drawing off of, but it's more than around $16,000 in value. And so the other programs would exclude you, but Hoosier RX could help pay your Part D monthly premium up to $70 because it doesn't look at your assets. So those are programs that SHIP counselors know about. We have printed information on. We'll send it to you and we can help you with the applications. And we're happy to do that. Here's how you find your closest SHIP site, just by giving us a phone call. Or if you're into the computer thing, you can Google us or look us up online at medicare.in.gov. We have a couple of ways on our website where you can see your closest counseling site. We have a map of Indiana with little dots all over it that indicate where we have in-person counseling sites that you can click on. And there's also a list on there. If you want to see us do a presentation live, we do have an events list on that website too. And there's some really terrific information. And I will say, going to a website is not my primary way that I like to find out information, but we have a very user-friendly website. And then, of course, follow us on all the social media channels. And we appreciate you joining us on this Facebook Live. So if there are no questions, Megan?
There is no
Oh,
question.
all righty. Then you've been warned about the 5 + 6 bonus question, the common mistakes made. So Megan's going to tell us what's coming up on our Facebook Live programs.
I am. And thank you for all that wonderful information, Susan. And if you do think of questions or you're watching this recorded, feel free to chat those questions in the chat box. We do watch for those questions after the fact, or sometimes we miss questions during the live. Sometimes the browser doesn't upload for us correctly and we miss those questions. And it has been a little glitchy this morning. We've noticed a couple weird things. So if we do miss questions, we will answer those later or when we see them, if you watch this as a recording. So what do we have coming up in August? So August the 11th, we have Social Security on with Susan. Understanding Social Security retirement, spouse, and survivor benefits. That is going to be a very important and educational live to watch, either live or as a recording. On What to Know Wednesday, on August 13th, we have Where in the State is SHIP? Susan is going to come live from the Indianapolis State Fair and show us all the important fun activities from our ship booth at the Indy State Fair. And then I am going to take us on a virtual field trip of our website so you can see where in the world all of the ship volunteers and ship staff will be um, this year, this summer, this fall, this winter in the state of Indiana for events and presentations, and even fall open enrollment events that we have scheduled so far. So you'll be able to see where you can go find us on that live. And then we're going to wrap up the month with Medicaid Explained with the director of the Senior Law Project. So that we have some very informative, fun, and educational lives coming your way in August. So mark your calendars for those. And then in September, we have our quarterly um, Medicare, new to Medicare live. And I am searching for that date. It is a Thursday at
That's
6 p.
September 18th at
Thank
6
you. I couldn't,
p.m. Eastern Time,
thank you.
September 18th. So mark
Thank
that one on your calendar too.
Yep, I couldn't remember if it was the 18th or the 19th. Thank you, Susan. So lots of great educational um, trainings coming your way. So mark your calendars. And until next time, have a good week and a good month. So